good morning, good afternoon, or good evening, depending upon the time that you're watching this video. And, we try really hard each time we come on to share some, some feedback, from some professionals within different fields, different realms of autism spectrum disorder with the community around the state of Florida and literally across the world. And so today, once again, we bring someone to you guys to share their little perspective and bit of information from across the ocean. So today we have Dr. Judy Hebron. She is from the UK and she's joining us this morning as we discuss girls on the autism spectrum. So I'm going to real quick just read a brief bio. Dr. Hebron is an associate professor, chartered psychologist, and fellow of the British Psychological Society. She leads the Bachelor's Psychology with Education program at Leeds University and contributes to teaching across a number of undergraduate and graduate studies. She's also the Deputy Chair of Business, Environment, and Social Sciences Joint Faculty Research Ethics Committee. That's a mouthful. And of course, for the purpose of today, she is the author of Education and Girls on the Autism Spectrum, Developing an Integrated Approach. So Dr. Hebron, thank you so much for joining us today. Really appreciate it.
Thank you very much for having me. I'm delighted to join you today.
So as you guys know, especially those who are parents of girls, we have so much more that we need to learn about girls, so many more ways that we need to figure out how to help them, how to educate them, what to do for them, because, girls and boys, they got some differences. They have some differences, not only biologically, but in the way that they learn, that they process. And we want to be able to help parents and teachers and young women on the autism spectrum and older women on the autism spectrum be able to advocate, get the things that they need so that they can have a higher quality of life. So that's going to be the gist of our conversation today. So I think I'm going to start with girls on the autism spectrum are quite often underdiagnosed. So Dr. Hebron, why do you think that is?
Well, that's a really interesting question. I think it's a great one to start off with. And it's one that's kind of gained momentum in recent years in terms of attention. I think historically, autism has tended to be portrayed as a developmental difficulty that's mainly experienced by males. And it's long been believed that if girls were autistic, then they tended to be quite severely autistic with relatively high support needs, and boys more likely than girls to be diagnosed with what we used to be referred to as Asperger or Asperger syndrome, and with perhaps lower perceived support needs. So it's only quite recently that we, as the research community, have started to explore this idea of a female, what we call a female autism phenotype, and to look at autism in girls and women. So this is really just, I suppose, predominantly the last 5 to 10 years, but the momentum is increasing. So, a few years ago, we were looking at a ratio of girls to boys as being about, currently we're looking at a ratio being maybe about 1 to 3, but until quite recently, it was 1 to 10 or even more. So actually, this ratio has narrowed quite considerably. And I think there are various reasons and explanations for this. So there is this historical bias towards this what we call the male autism phenotype, and male participants tend to predominate in autism research. Okay, so if we go back to Canner and Asperger, they did focus predominantly on boys. And also we've got the screening and diagnostic tools that tend to, or are widely thought to have been more sensitive to the male autism phenotype, because they were originally developed with mostly male samples. Not everybody agrees with this, but I think there is an idea or an understanding that the diagnostic tools may be slightly biased more towards identifying boys than girls. And so we find that autistic females often come to the attention of medical professionals because of mental health difficulties rather than autism itself. And it's when they arrive with the professionals that they might say, well, okay, there is a mental health issue here, but could this also be autism? And it's often at that point that perhaps they'll go down a diagnostic pathway. And this can lead to it happening later. So girls do tend to be diagnosed later than boys and women as well. And there are a number of studies that have started to look at this. And of course, masking and camouflaging are also reasons why autistic women and girls might remain undiagnosed or diagnosed later than their male counterparts. I know that's something that you quite like to talk about today.
Right. Well, that was going to be my next question.
Yeah.
So the whole piece of what you refer to as camouflage in your book. So can you explain a little bit about what you mean by that?
Yes. Yeah, I can talk about that in a bit of detail actually, because I think it's especially interesting. And again, it's something that we're learning more about, and I can signpost some useful reading for anybody who wants to know a bit more about that. So this idea, the camouflage hypothesis, it's what we often refer to as social camouflaging, masking, pretending to be normal in order to sort of conform to society's expectations of how a girl or a woman should behave. And we think that it's a strategy to try not to be seen as different, to try and fit into this world, that perhaps there is often the autistic girls will feel there's a mismatch there. This might be to reduce the chance of being bullied, or to fit into a social group, or as an adult perhaps to fit into a workplace better. And it's not just, one thing I do need to point out is it's not just autistic girls and women who do this. We found this in boys and men as well. And there was one recent study just from last year actually, where they found that 70% of the autistic adults who took part in the research said that they use camouflaging regularly. So it is across girls and boys there. But what we do think, and research is starting to find evidence of this, is that camouflaging is more common among autistic girls than boys, and this may be one of the reasons for underdiagnosis. Okay, because what we do know is that from research is that girls tend to have more internalized behavior than boys, which makes it harder to spot. Girls tend to be more motivated to have friends, which makes them appear, at least on the surface, to fit in better. And girls' social difficulties can be quite hard to spot because their sort of surface level social communication and interaction skills are often quite good compared to boys. So they do become harder to spot before that. And an example of that will be is if a girl has actually quite good language skills, expressive language skills, she's very articulate, for example, this can actually hide the fact that she's missing some of the social cues, such as literal language and stuff like that. So although she might come across as very articulate, there may be things that she's missing and not picking up on. Okay, so there are some perceived benefits, I think, to camouflaging in this, this ability to fit in, but increasingly they're identifying in research that there are potential costs to this as well. And these are some things that I've certainly noticed, Caroline and I, in our research, is that it can be absolutely exhausting, this camouflaging, and it can lead to really high levels of stress, anxiety, and potentially also depression and other things. And it's really interesting actually, and Caroline, my co-editor in the book, flagged this up to me, that it's recently been found that parents of autistic girls tend to have more difficulties at home with their daughters, where we find in terms, I suppose, in terms of stress and anxiety at home, we find the opposite in boys. Okay, and I've come across this on a number of occasions in my own work, and certainly with Caroline as well, where autistic girls might be seen as model students at school. They're great, they behave, they get on with their work, they're not a problem in the classroom, but what they're doing is they're holding it in, they're pretending that everything's okay. And during the course of the day, that anxiety increases and increases till they get home, which is a place of safety and security, and it all comes out. And parents can quite often, not always, but quite often see a real difference in behaviour when those girls arrive home and they're distressed, they're upset, they're extremely tired. And teachers don't necessarily see this. So I think, communication in school is really, really important there. So there's a lot to take into consideration. One thing I would like to recommend, and it's open access, so anybody can see this, you don't have to pay, is an editorial published in September last year by Dr. Will Mandy at UCL. And he talks specifically about camouflaging, and he provides a wonderful summary of our understanding of what it is. And I can provide you with a link for that, Stacey, if you wish. It's very easy to find and it's open access, but it's really, really good in kind of understanding what this camouflaging is about.
That would be awesome because, yeah, I mean, it's you can really hear how so impactful that would be for women. And, the young girls grow up to be women, and we want to be able to give them what they need when they're younger so they're ready when they are adults. So I want to go back for a minute to the whole diagnosis. So kids who are either not diagnosed, like at all up into adulthood, possibly for some of the animals, but maybe, later diagnosed than the males, their male counterparts in school. So how could that lack of early identification impact them educationally?
Well, I think there's huge potential impacts there, because I think that probably the main thing is if we don't know that an autistic girl has additional support needs, if we're not aware of these because she's presenting and able to say, well, it's okay when I'm at school, how do we then provide the interventions and the supports if we can't see them? And I think it's that difficulty in actually being able to identify and being incredibly sensitive to be able to see that perhaps these quite subtle differences, you know, when we're used to seeing boys perhaps behaving a little bit more overtly with some of the signs of autism, and the girls potentially can be more subtle. Obviously there's a lot of overlap between the two, but this is something that, you know, we're aware of. So, and we do know from research, I've just got a couple of examples here, that we've got evidence that school staff are less likely to be able to identify autistic girls. They're less likely to refer autistic girls to the school psychologist, and they're more likely to perceive autistic girls as having fewer difficulties than boys, and they tend to report fewer social difficulties, fewer perhaps repetitive behaviours, and fewer concerns because of this externalizing behaviour. So they're not on the radar in the same way as boys, some of whom may make it a little bit more apparent. As I say, there is this overlap between the two. So I don't want to kind of over sort of generalize differences between the boys and girls, because there are a lot of similarities, obviously. But for girls, this potentially can lead to inequalities in identifying and diagnosing the autism. And obviously, this is of real concern to parents and carers. And some of them in previous research have found that staff don't recognise their daughter's needs. And this can lead schools to, not necessarily through any fault of their own, not being in a position to put the supports in place that they need. In addition to this, girls can also spend many months, if not years, going through very time-consuming diagnostic processes, which may be co-occurring conditions, or they may be conditions which are kind of made worse by undiagnosed autism. So things like eating disorders, self-harm, physical illnesses, and obviously anxiety related to school refusal before that autism diagnosis eventually comes. And it can take months, if not years, to get to that point. Okay, so it's not an easy process. And obviously the impact of that is significant distress to the girl and her family, potentially substantial gaps in education. We're just starting to learn a little bit more about school non-attendance, and it appears to be particularly high among autistic girls. And I've certainly got one of my PhD students at the moment looking at school non-attendance among autistic youngsters, and particularly girls. So there are potential, you know, really quite significant impacts there.
What do you see over time for women as far as, is this changed very much, this trend for females, or it's pretty much the same,
Do
and
you mean
being the later diagnosis and not catching them very early?
I mean, I think it's changing as the awareness is increasing, then it's changing. And we have to hope that over time, with improved you know, training and awareness of teachers and in the general population as well, because I think autism awareness at a sort of a societal level is incredibly important as well. But I think, you know, I can only speak for girls rather than women at this stage, but I think there has, you know, there has been increased research over the past few years. There is a gathering momentum, but obviously we do need more of it. And, you know, I hope very much to be able to contribute to that in the future. There are some fantastic retrospective accounts of adult women reflecting on their childhood experiences. And these have been really, really influential. I know a number of those have come out of the States as well. Obviously, in the last 10 years, 5 to 10 years, research has begun to focus on prevalence in girls and this female autism phenotype. But even things like research on camouflaging, for example, has only really picked up pace in the last few years. Now, in the UK, we've got the NAS, which is the National Autistic Society, and NASEN, which is the National Association for Special Educational Needs, who produce some quite helpful training and guidance for schools. But I think research has probably lagged behind that a little bit, and, you know, we're just trying to pick up and actually look at the evidence base for what needs to be done there too, that what really works, basically.
Now, I know that you kind of talked about this a little bit already, but how big of a factor do you think it is, the external behaviors that you see in a child, boys versus girls, has to do with their overall identification and access to services?
Yeah, I think this is quite a tricky one, because I think you know, as I mentioned before, we have to be careful not to say, well, autistic boys behave like this and autistic girls behave like that, because that's not how it is. And I think, you know, we've got that spectrum there. It's part of the autism spectrum, and we will see some boys who are very adept at camouflaging and some girls who aren't so great at it and stuff like that. So there is considerable overlap there. But I think in terms of external behaviors, I think as humans, we're much more kind of attuned to seeing those external. It's much easier to spot. I suspect this might be one of the reasons why girls who have quite a lot of externalizing behaviors, autistic girls, are picked up and diagnosed earlier. And actually those girls who camouflage incredibly well, it takes considerably more time to actually identify those girls, to pick them up, to take them through that diagnostic process. And I think, you know, this is an issue that's common to all invisible conditions, and it takes a lot of training, it takes a lot of sensitivity to be able to pick up on that. So, you know, as I mentioned before, there is a tendency for boys to externalize their difficulties more than girls, and I think this is likely to contribute to differing rates of diagnosis. Camouflaging is likely to play a part in that. And just coming back to a previous point I made as well, is one issue is around diagnostic tools. Some researchers have identified that the screening and diagnostic tools used for autism have traditionally been more sensitive to the male autism phenotype, and the behavioural descriptors focus more on externalizing behaviour. So, you know, if a girl is very much internalizing her difficulties and her differences, it is going to be that bit harder to spot. So I think, you know, this is something that moving, I'm aware that, you know, diagnostic tests and interview schedules and such like are being developed and have been developed that are supposed to be more sensitive to picking up on the differences that girls may present with, or some of those subtleties perhaps.
In your book, you mention 3 different ways that educators are hopefully getting a little bit better when it comes to educating. And so the 3 are intervention, practice, and experience. So can you talk a little bit about each of those and kind of what you mean?
Yes, I'd be happy to. I'll mention experience first, if you don't mind me changing the order around a little bit, and then I'll talk about practice and intervention together. And I think, I suppose, you know, in defence of the teachers as well, I don't think that, you know, that where there's a lack of understanding, it's not any fault of the teachers. Quite often it's a lack of training, and you know, I come from a teaching background myself, and I think, you know, quite often as a profession we're crying out to learn more about the different needs of children in our classrooms and such like. But obviously, that, you know, we are developing more things. There are materials starting to come out now. But just coming back to your question then, in terms of trying to improve the educational experience for autistic girls, in terms of experience, when Caroline and I were putting the book together, we agreed right from the outset that the voice of autistic girls and women was essential in the book. And we really hope that the lived experience of the 2 young women in chapters 1 and 2 will help to kind of provoke practitioners, professionals to critically consider how they actively involve autistic girls and women in the activities that they prepare and do with them, so that their perceptions, the autistic girls' really drive whatever areas are prioritised for intervention. And, you know, we also need, and I think this is so important as well, because a lot of autism research has traditionally been very deficit led. So although we acknowledge that many of these young people do experience significant challenges in their school years, we also have to really recognise and celebrate their strengths and their successes. And you'll see that in the book, you know, we very much wanted it to be a balanced book, so there are many positive stories in there as well. And Rachel, who wrote chapter 1, she's just qualified as a teacher, and she was very keen to show that actually she'd had some real successes in her life, as well as some challenges as well. And I think that's a really touching chapter there as well. So girls' perspective, very important. They're important to informing our understanding of things like school non-attendance and all sorts of things like that. And this, you know, this contributes to debates around inclusion as well. So it's very important to have, if you like, the voice of the autistic girl central to it. Or that's something that's mirrored in current drives in research more generally as well, is to try and, you know, very much include autistic people in the research, so they become participants and they take part in our research as opposed to being researched upon, which has been unfortunately a bit more of a traditional approach. So in terms of practice, good autism practice is absolutely vital for all autistic, well, all children, whether they're autistic or not. And many practitioners have been developing good practice, and a key aim of our book was to try and capture some of this emerging practice and share this with professionals and practitioners who are working at the front line to support autistic girls in education, even if there are significant research gaps at the moment. So we've got, for example, chapters on primary or elementary education, mainstream and specialist provision, and the chapter I contributed within the book was transitioning from elementary to high school and some of the challenges that might come with that. As well as exploring the potential challenges I mentioned a second ago, we're very keen to look at strategies, how things can be made successful. So our chapter authors provide some great advice on good practice, effective strategies. For example, there's a chapter on primary or elementary education. Lynn McCann talks about sensory and emotional support programs. And Sarah Wild, who is the head teacher of a specialist school for autistic girls, she discusses strategies for coping with high levels of anxiety during the secondary years or the adolescent years as well. And this, of course, links into intervention. So there are some promising interventions emerging that are more specific to autistic girls. And these tend to focus more on social needs and identify slightly different approaches, but they are slightly different because there's considerable overlap in terms of what sort of interventions work. So we do know that the literature we've got about interventions for autistic girls appear to be very similar to those of autistic boys, okay? But there are nevertheless some important differences which we need to know more about so we can maybe make these more targeted. So for example, we need more sensitive school-based assessments. We need interventions to address issues around puberty, because obviously that's very different for girls and boys. We need more sensitive interventions around social understanding and the sense of identity, okay? And in particular, it's things like being an autistic girl when autism is still seen as a largely male condition, okay?
There's really so many differences and that really get left off to the side someplace. And I know that, even when it comes to inclusion, inclusionary education or lack thereof, when I was sharing with you before we came on that, you'll walk into an autism classroom and you might have one, maybe two girls, if you're fortunate, in those rooms. And so where are the role models? Where are the feminine peers? I mean, where are the girls that they can hopefully look up to and develop relationships with and gain something socially by, further their social skills, rather than basically, you're surrounded by a bunch of boys that are boys. Boys are boys, and I have to say, I don't know any moms of a daughter, just any girl, that would be thrilled with having their daughter be in a classroom where they're the only female in the room.
Yes.
Oh, that's not an autism thing. So all you parents out there, you need to be looking at your kids' classrooms if you have a girl, to look to see what's the dynamics in the room. Because it may not be what you really would like it to be. So just, we spend a lot of time on this program and the Autism Society of Florida trying to help parents know the advocacy skills that they need so that they can, plug forward and make those positive changes. So can you mention maybe, because I know you covered this in your book, like some barriers. So once we've kind of got an idea, okay, so we've got a girl, we've got some differences here, but what might a barrier be that they might find when it comes to accessing a good education, other than when it comes to the diagnoses anyway, that it's kind of heavy on the, looking towards the male kind of the way that they tend to think about things. So other than that, but just in the general practice of education, what would you say would be a barrier for a girl, trying to get a good education?
Yeah, I mean, part of this is going to go back to the idea of the girls being a little bit more difficult to identify sometime, and if there's a lot of camouflaging, that the educators may not be aware that there's an issue there. And I gave you the example of the girl who perhaps is a model student at school, everything seems to be going absolutely fine, And particularly in cases where the girls are very cognitively able, they're bright students, and if they seem to be doing well academically, then it's very easy to miss the social issues potentially. So a girl who's absolutely getting A grades in the classroom tests and stuff, but what's she doing at break time? What she's doing at lunchtime? Is she on her own? Is she with groups of other students? Is she being bullied? Is she taking herself away? Is she able to interact with other students? Does she have friends? And all sorts of questions like that can be quite easily missed, I think, if a student is doing well. And I think, not all girls will have barriers to education. Not all autistic girls do. Some of them thrive, some of them do very well, possibly because they're in very supportive environments with a very, understanding staff and stuff like that. But of course, if we know who these girls are, then we are able to offer support if it's needed. If we don't know who the girls are, then we can't offer that support. So I think one thing, I suppose one particular barrier, and this is obviously more the social side again, is in a school environment. Autistic girls, we find they tend to be very motivated to have friends, but this can also, because there might be some challenges inherent in that, they may find it difficult to read some of the social cues around them. This then puts them at quite a high risk of being bullied as well. And so, obviously, we know that children who are bullied at school don't do as well academically. So there's always this knock-on effect as well. So, being bullied, not coping well at school is obviously going to lead to a lot of stress and anxiety. Any unhappy student is not going to perform to their best. So, there are many potential contributors to having barriers to achieving academically, to being happy at school. I mean, obviously school is so much more than just tests and learning subjects. There's a whole social side to this as well, and they all impact on each other as well.
Yeah. And, as a female, we're just so hard on each other.
Particularly
I
when they get to puberty.
Yes, I mean, I wish we weren't that way, but women are catty and we tend to be a little more judgy than men are. And, so, I encourage anybody watching this who has girls, try to make the next generation better than the one before, because there are, our society has never been more diverse than it is today. And so it's not just about, with the bullying issue, not just girls or boys or whatever with autism. I mean, it's a society in general. We need to learn how to do better. And social media will definitely teach us that. I was watching a video just recently that was on the social media impact to the world. But the part that really got to me the most was when it talked about girls at around the ages of 12 or 13 who, it used to be when people were my age, we go to school if we had, if we had bullying, if we were experiencing negativity in school, we knew when we got home, we were home and we were safe and we were protected and we were with our families. But now this thing here, you don't get a break. Young women do not get a break. So if they're very connected to their social media, the bullying that occurs in school may be continuing 24/7.
It comes into your house. It's pervasive, isn't it? You can't get away from it. If it's on your phone, it's with you 24/7. And
Right.
That's a big concern for lots of students, isn't it?
Yes. And for those girls that are experiencing that bullying because they don't wear their hair the right way or they don't talk the way that other girls are expecting them to talk, it can really be just relentless. There's no escape to it. So I encourage you guys to look at your kids' social media and what they're doing and what they're using. So for my last question, I'm just looking to see if you have some strategies, maybe 3 that you might be able to mention that parents of girls, let's say 8 to 12 or 13 years old, that they might be able to help them to further their relationships, their social skills, to kind of hopefully, because females in general are just more social beings than males are. And so when we have these girls who don't have the social skills that, again, is expected by, other girls, I wish that everybody could accept everybody, but unfortunately, that's not really, the world doesn't really understand differences yet, which is unfortunate. But, so I don't mean to say, oh, we all have to change who we are to conform to society. So please, nobody assume that's what I'm saying.
Mm.
I just, do you have any skills that maybe, or any strategies that maybe we can help girls so that they can further develop the social skills so that they could be, like I said, happier and more fulfilling little people?
Yeah. Well, I think, I can definitely make some suggestions. So these are the things that Caroline and I discuss and things that we've seen happening in school. So this is, it's kind of, there's not a lot of research on this area at the moment, but sort of more anecdotally, these are things that have come through to us when we've been working with schools and young people. But also there is some early research starting to emerge in this area. And I think I'll just go quickly back to the point and say that we do know that most of the time interventions for, I suppose, early teens, or you're like your 8 to 12, 8 to 13-year-olds, most of those interventions that work with boys or have been targeted at boys will also be effective with girls as well. So, a lot of the time, female-specific interventions aren't needed. It's more the case of trying to be able to identify and understand needs of girls. However, there are and I've identified 3 things here as well, as you asked, that can be useful, and we've heard some really positive things about. We've heard a lot of good stuff about girls groups, which provide peer-to-peer support, help to develop social understanding and provide opportunities to, if you like, share common interests. There is an emerging evidence base on this. These might be at school, but they don't have to be at school. They could be support groups in the community, for example. I've certainly seen 1 or 2 really good examples of that, like Saturday clubs, where it's actually just the girls who get together and they have a natter and they have a bit of fun and they're all silly with each other. But it's just kind of that getting together and sharing experiences and understanding each other, which can be quite useful there. And linked to this potentially are buddy systems. So I mean, I think there's quite a lot that's done certainly in UK schools around buddy systems, but involving support perhaps from other autistic girls, perhaps older ones. Okay, so to this younger girl who's perhaps 10 or 11 years old, having an older girl to support her in sort of mentoring, almost like a mentoring or role model relationship. And we've seen, examples of where that can work really, really well to sort of show that younger girl who may be finding it quite worrying at school and stuff like that. Actually, it doesn't have to be that way. You need to talk to have a word with your mum, or this worked for me when I was your age, or right, let's see what we can do to get support for this. So actually having that older mentor or role model who understands and who gets it, it can be really, really useful. And also another one that has emerged very, very recently in some research that I was involved with, is that having a trusted teacher or member of school staff can be incredibly important and useful for that autistic girl. So that member of staff, and I remember one autistic girl saying to me, really like my art teacher, she just gets me, and I don't need to say anything, I don't need to explain, and she understands. And having that point of contact in school can be so useful. It can be calming on a difficult day. I've heard of girls who said, if I'm having a really bad time, I know I can go and sit at the back of that teacher's classroom and it's okay. Nobody will ask any questions. But having a trusted member of staff, a trusted adult who's probably isn't on the autistic spectrum themselves, but who understands, can be really, really useful for those girls.
Yeah, I mean, when my son was in middle school, one of his teachers requested a meeting with me, and I thought, uh-oh, what's happening? And I go in, and she loved his very structured mind, the way that he operated, and we got to get this done, and then this done, and this done. And she didn't know much about autism, and she asked me to kind of give her like a autism 101, and we chatted, and she said, I love that. If I had a classroom of students who think like that, I'd be such a happy teacher. And she even told me that she thought, she needed to go back and look at the way that she processes, because she was thinking, I have those same qualities. And so that was pretty interesting, because here I was going in there thinking, uh-oh, something happened in there. And here she wanted to share that with me. And she became his go-to, so that even as a boy, he knew he had somebody on school staff, especially during middle school, which is such a trying time, to be able to go to when he just needed to catch a break around somebody who got him, who understood his rigidity and his need for consistency, when some other people would be just like, get over it.
Yeah.
And, if it was
And
that
also,
easy.
I guess somebody who champions their strengths, because it is too easy to focus on the things that in general, I speak in general, we were very much focused on what we can't do as opposed to what we can do. And these children, these girls, they will have amazing strengths. And I think, we have to celebrate those as well and see that this fantastic sense of organization and structure is great because they never forget to hand in their homework, for example, in one case, or they always remind the teacher if they've forgotten something. So that, there are all sorts of positives as well that can come out of this. And I think, we do have to balance that really carefully.
Well, and one of the things that I love about your book, if you could hold your book up for everybody to see, is
Shiny
that
copy
it
here.
includes women on the spectrum were like part of the development of that book, which makes it so amazing to me. And so that all of you guys know who are watching, I'm going to put the link below so that you
Sure.
can purchase that book. So if you're a teacher and you're dealing with female students, if you're a teacher, actually, you should be dealing with female students. So, look into the book for parents of daughters, for the community members. If you happen to know someone who has a daughter or a niece or a granddaughter or whoever, I encourage you to get the book because women on the autism spectrum have, yes, they're kind of coming on their own right now. And I'm actually really fortunate to sit on a couple of committees where I have women on the spectrum that sit with us, that kind of give us as parents the perspective of really considering what we do from their perspective as the individual who lives with autism. And I think that far too often, especially when we talk about education, decisions are being made without really consideration of the perspective of the child. And I think, at least in the United States, I can't really speak for the UK, but in the United States, we have an old way of doing education that I think COVID has really pulled the blanket off of, because we're kind of a mess right now when it comes to education. And so many students here in the United States are not in school right now. And parents have had to pick up the ball and done the education at home. And for those parents who really are teaching from the perspective of their child and what their child is, who they are, what they need, these kids are actually making really nice progress. Where when they're in school, I don't know, I think our school system just thinks that every kid should be the same kind of person. And so we're throwing the same kind of ball at them and we're expecting them all to be able to hit. And it just doesn't really make sense. But that's what we do. So, everybody, just I'm going to put the link here so that you have that. We will have this video here on Facebook. I'm going to check and see if we need any edits, but it will be here on Facebook. It's going to be on our YouTube channel, Instagram. So check it out in all those locations. Get the book. And Dr. Hebron, I want to thank you so much for coming on and talking to me about this really super important topic.
Thank you. Well, no, it's been an absolute pleasure. And I think, it's a topic that's very close to my own heart. I spent many years teaching myself. I've worked with many autistic girls and their parents and autistic adults as well. And I think, it's something where we're getting better to learn more. It's lag behind, but we're getting there. And ultimately our aim is that the autistic girls are getting the best possible deal out of school. They're happy, they're enjoying it, they're meeting their academic but also social potential as well, and they can hopefully look back on it as a happy time as opposed to an unhappy time when they were bullied and stuff like that. So I think this is the important thing as we move forwards.
And I love what you just said, and I hope everybody caught that. There's social potential.
Yeah.
Because that's the one thing that I don't think that we pay enough attention to. Maybe that's going to be a topic of another one of these. But helping kids find their potential, guys. It's so important. All right, thank you, Dr. Hebron. Thank you, community, for coming on and listening. And we will see you guys again next month.